Hey guys, do you work in emergency medicine? An absolutely crazy and intense environment where you see things every day that a regular person doesn't see once in their entire life. You feel burned out, unappreciated, like there's no one you can talk to about the things you are struggling with. Well, you are not alone. I have a bunch of real professionals with real stories here with me today that can relate to your struggles. I've struggled with burnout, discouragement, frustration many times and still struggle with it. My name is Aaron. I've been in emergency medicine for 15 years as an EMT paramedic and now emergency medicine PA, and I am the host of Practical EMS Podcast. And with that, I will introduce my guests and we will get started. So on today's show, guys, this will be kind of the January panel. I called the last series our December panel because that's when we kind of released all of it. This one's going to be kind of a January release through the beginning of February. We'll kind of be chatting with these same folks about a bunch of different topics, and hopefully you guys find some value from that. With that, we've got two returning guests, Casey and Nathan, and we've got two new guests, Doug and Sarah. So let's start with
This is Sarah.
Sarah, and we will...
Sarah,
clarification, confusion. So Sarah, if you wouldn't mind just saying kind of your credentials, your length of time in emergency medicine, and if there's like any specific story that like inspired you to get into emergency nursing.
Everyone's watching.
Oh, well, hi there. My name is Sarah, and I've been a nurse for a little over 9 years. I have worked in emergency medicine for 4 years next week. And it's really been quite the journey and finding, honestly, while it's high burnout job situation, it's actually super fulfilling. I definitely talk with my hands. So, and it's been super inspiring to kind of find the team and find the differences that emergency medicine can inspire in both the teamwork and also the unique stories and illnesses that we get to see.
Totally.
The thing that really inspired me to become a nurse at all was my grandma was a nurse for 25 years, and she actually saw the beginning of emergency medicine. She graduated in the 50s, and it's back to like the tights and the hat when you were wearing it. And then she watched the emergency medicine specialty really evolve. And then she became a nurse at a local ER for 20 years. And I never thought that I had quite that personality, but I eventually gave it a shot after 5 years of nursing. And I definitely feel like I found a home.
Very cool.
Nice.
Casey, why don't you go and kind of introduce yourself again?
Gosh, I've been on here 3 times. I mean, really.
You have. I guess that they say that most podcast audience is kind of a rotating pool, though.
Yeah.
So they may not know you.
Well, I was just going to comment that, knowing him, there's probably a bunch of new people.
Yeah.
Because once they hear it, they're like, ooh.
I bet you I know your grandmother.
Actually.
I just love your
we'll talk
beard.
later. Yeah.
I wish that the outfits,
Love
the
it.
nursing outfits hadn't changed.
Yeah.
But that's just my opinion.
I'm Casey. I've been a paramedic for, 160 years, something like that.
You created EKGs.
Yeah, somebody asked me the other day, were you there when Christ was born? I said, yes. He had brown eyes when he was born. Yeah, so I've been doing it a while. At the place I'm working now, I've been doing it 360 months. A little more now, 363 months. But I've got a few years before that. Got into paramedicine actually from when I was little. I told this story before, I think, when I was here. But a couple of brothers lived down the street from me, and they worked for an ambulance company. And they used to bring their ambulance home, and they would run from home at night. So I used to see that ambulance go up and down the street, going on calls, lights flashing. I think, like I said, I think I have something about rotating lights that kind of, I don't know, just
triggers it in your brain.
Sucked me in. And so I was about 5 years old, and I always wanted to do that. And I dated a girl and eventually married her, and her dad owned one of the ambulance companies in town. And so I worked for him, and one of the doctors in the town, we didn't have paramedics. And so he saw some potential, I don't know why, in me. And one of the other medics that I'd gone to high school with, or one of the other EMTs that I'd gone to high school with that worked with the other ambulance company. And he asked us if we wanted to go to paramedic school, and he would pay for it. And we said, yeah, let me twist my arm. And so, yeah, we did that. And we went to the same school, and it was the best school in the world at the time. And so I went to school and became one of the first 2 paramedics in the city that I was living in, and got my start there, and then came here. And I was told if I wanted to hone my craft, this was the place to do it. And they were right. So came here, and then I've been to Arizona and stuff since, but I've been back here for over 30 years. So
Very cool.
yay.
I'm still trying to divide 360 months by 12.
Oh,
to
did you
figure
see me
out-
doing this?
I'm still
30
not.
years.
Okay.
Oh, I'm like,
30 years.
that's a lot of numbers. I'm not good at math.
Yeah.
My name's Aaron. I'm an emergency medicine PA. I was an EMT, I think, for 2 years, paramedic for somewhere around 10, and went part-time, I think, in 2018, I think, somewhere around there. So I've been an emergency medicine PA for 4 years and haven't been practicing as a paramedic for about that same length of time.
You should come work.
I've thought about it. It's just a lot. I mean, things change like any field, and like I can't keep up with the technology changes and how you call into the hospital
It's easy.
and how do you talk to a patient. I don't
That you know how to do.
All you gotta do is say, stop that. It hurts when I do that. Don't do that.
I just became an EMT because somebody told me to get it, and I didn't know what I wanted to do. I knew I wanted to do something in medicine, and someone was like, well, get your EMT. I had no idea what that was, and so I got it and just kind of fell in love with emergency medicine and kept progressing with it from there. I don't think I could ever switch to a different specialty. Everything else I think would be too slow paced. I like shifts to go by quickly, and emergency medicine definitely does that for me. So, Nathan?
It's beautiful. Hey guys, I'm Nate. If you guys do know me, I've been in EMS for about 9 years now, and I'm going to be working at a hospital, so that's going to be interesting.
Maybe we can talk about that transition actually a little bit, because a lot of EMTs on forums and stuff like that really want to know what the difference between hospital and
I'd
an
appreciate
ambulance
it.
looks like. So
But yeah, so I mean, I joined medicine for the depression, suicidal. I'm diagnosed bipolar type 2, which is more the depression side. To this day, I don't understand what happiness is. I don't get it. I just don't. I have 5 suicides under my belt. 3 of them I should have succeeded. I used to be an alcoholic, an opiate addict, and I used to prostitute myself for those drugs. So I actually joined medicine for that side of things because that shit gets overlooked a lot. That's pretty much, I have a strength, ADHD, sorry. I haven't taken my ADHD meds yet. I'm sorry. I felt a string and I had to pull it. That's pretty much it with me. You got it.
I'm up. All right. So my name's Doug.
Hi, Doug.
I'm an emergency medicine physician, and I've been one for here where I'm currently working for about 23 years. And before that was 1 year in a different state. As far as stories of why we got into this, I don't really have as good a one as everybody else does. It was
Your story's
more of a-
valid. It's valid.
It's boring, but it's valid. It's more of I was in high school and I loved science. I loved math. I loved physics. I loved chemistry. So I went into college and got a biomedical engineering degree. And I thought, oh, this is really cool. And then I started doing it, and I thought, I don't want to sit at a desk in an office for the rest of my life.
Yeah.
So I was kind of turned on to medicine that way. And, ended up going to medical school and went around all the different types of specialties that they had and pretty much fell in love with each one as I did it. And one of my probably one of the last ones I did was an ER rotation. And I thought, oh yeah, this is badass. So this is what I want to do. This is what I want to feel. I love the excitement of it. I love the see them, get gratification, fix them, never see them again.
I
type of-
literally
type of
feel
attitude.
so like I've done jack shit with my life just hearing that. You say
You're
chemical engineering. I'm like, damn.
Yeah. Well, I'm like damn near as old as Casey is probably. So.
No, you got 10 years with some experience. That's all it is.
Yeah. So, when we moved here, I love the job. I love the people. I did nights for 13, 14 years, loved nights. Finally had to transition to days as I got a little bit older and, due to family stuff. And so now I do all day stuff. So it's a kind of a different group of people that I work with, different group of paramedics that I get to see, different cops that I used to see all the time that I don't see anymore. So it's kind of a transition from the night attitude to the day attitude. And there is a definite difference there.
mm-hmm.
But I like it. I like sleeping all night. I like being at home with my family. So,
Yeah.
That's, why I got an ER rep job, was just because I thought we get to do a bunch of cool stuff and need to really help people and immediately get the gratification, both personally and for them.
And then you never see them again.
And then we never see them again.
Well, usually.
I see a lot of people a lot of times. But in general, the feeling is you treat them, you fix them, or at least you help them, and then they go.
Yep.
So I agree that as far as with Aaron, that it'd be tough to do a different specialty.
Yeah.
That is a little bit slower paced. Even though I've gotten older, I'm like, I still like it.
Mm-hmm.
So it's different, but I still like it.
Yeah, that's the one thing I was having problems with, because like whenever I did get fired, I was like, what am I going to do with my life? Like, am I going to stay in medicine? Because like I have a very odd, I know how to lock pick very well. So I even looked at lock picking jobs.
Oh, I've got one.
Where is this going?
Yeah.
I'll talk to you later.
Okay. Yeah. So I started like looking at that stuff, and then I'm like, I don't know anything else to do but medicine,
Mm-hmm. Yeah, that's about where I'm at. It's like if you even consider doing something else, people are like, why don't you just do something different? I'm like,
I don't know.
I can't.
Yeah.
I'm in so far down this hole that it's tough to get out. And when you have a comfortable position, you just kind of roll with it.
Yeah.
And just kind of look forward to your free time.
Yeah. I'm coming to the end of it. And I'm like, but I still feel good, My brain's still working for the most part. So I'm kind of wondering, do I really want to stop, because I love it.
Mm-hmm.
Yeah. So it's, I've been at crossroads right now.
But you have a right to take a break. I want just
You
make
put
sure
your time in.
Yeah.
You get it.
Just make sure you're the one that calls 911 every day of every second. And then and then people show up and you're butt naked, you're covered in shit. Make sure you do that.
I mean, if you haven't done that at least once in your life.
Are you even
Are
living?
you even living?
Yeah.
Everything you hear today from myself and my guests is opinion only. It does not represent any organizations or companies that any of us are affiliated with. The stories you hear have been modified to protect patient privacy, and any resemblance to real individuals is coincidental only. This is for educational and entertainment purposes only and should not be taken as medical advice nor used to diagnose any medical or healthcare conditions. I will say that I'm glad you're going to be working in the hospital I'm working in as a lockpicker, because there's a time I locked myself in a bathroom and there was nobody capable of getting me out.
At the hospital?
Yeah, at the hospital. I've
That's
never used that bathroom since. I went in, locked the door, and as I locked it, something did not feel right in that lock.
Well, if I'm in like my little cubicle and I get a text saying I need help, oh, what's going on? I'm stuck in a bathroom.
Bring your pics up.
Fortunately, I had my phone, so I called the charge nurse. I said, "Hey, I'm locked in a bathroom." She's like, "Aaron, quit screwing around. What are you, like, get back to work. What are you doing?" I'm like, "No, I'm really stuck in the bathroom. Like, I need someone to come get me out of here."
Bro,
so they call facilities. It's like 2 a.m. There's nobody capable of getting a door open. And so one of our docs, who happens to be able to lockpick, had to bust down this door. At one point, he's like throwing himself against the door, and then he has the tools to jimmy this thing open, and I've been mentally scarred ever since. So yeah.
I'm sure you know who it is. For a while, every time I'd come to work and he would be there picking locks, he'd have 6 or 7 locks and he's just picking them. And I'm like, what are you doing this for? He's like, I just want to pick locks.
I have invited him on the show and he's turned me down. So
does he work where we're going to be working?
Really.
You know, if that happens, I will never let that down.
Oh, people still bring it up. People that confuse me with one of our other PAs, Jason, people confuse me with him all the time for some reason. They're like, "Was that you or Jason?" I always tell them it was Jason. So.
Absolutely.
Confuse you with Jason?
Jason, yeah. I don't know which one, but so here's my little preamble about stories. The central theme of this episode series is stories. Stories are a huge part of our human experience, regardless of your profession. They help us make sense of the world. Each of us is made up of our own experiences and stories, and this is even more notable in emergency medicine, where we see things on a daily basis that can impact us. This causes huge highs and deep lows in our own emotions and can cause us to leave work on top of the world or crushed under its weight. In the quiet moments after the adrenaline subsides, we find ourselves surrounded ultimately by stories. Stories of resilience, hope, victory, and stories of despair and tragedy. Sharing these stories is not just a recounting of medical interventions, it's an offering of our humanity, a glimpse into the visceral and profound connection we forge with those we serve. We have all heard the question from the new student, what's the craziest thing you've ever seen? And I usually respond with, you name it, I've seen it, and move on with my life and don't answer the question. So I'm not going to ask you guys that specific question today, but we are going to talk about some stories.
My paycheck. That's the worst thing I've seen.
First, let's kind of talk about failures in emergency medicine and maybe a time that you failed or, a time where you learned a hard lesson. I think this is a field where we typically learn things every day. And so failure is very common and it's not something to be ashamed of. It's something that happens to us all. I'll kind of start with a story I have. It's not really a super specific patient, although it does center around a specific patient, I guess. But this is one I can think of that happened recently. I could tell you a million stories about times that I failed or have been ignorant of a condition or something. But this one was fairly recent. We'll call this lady 35-year-old. Came in complaining of left leg pain is her chief complaint. She's got history of blood clots. So, we're doing a DVT rule out. And when I'm ruling out a DVT, I typically ask them if they're having chest pain or shortness of breath. Because if we find a blood clot in their leg, do we have to be worried about one in their chest as well? So, are you having any shortness of breath and chest pain? She says no, but I have this weird feeling in my chest. And you're like, oh, okay, that's not really a totally negative answer to that question. But she's got some pain in her left leg. She's not tachycardic. Her oxygen sats are fine. Her creatinine's a little bit elevated, so I'm kind of hesitant just to order a contrast scan on her and kind of affect her kidneys that way. So I kind of wrote it off and said, you know what, we're probably gonna find a DVT. We're gonna treat her with blood thinners anyway. So if she has a blood clot in her lung, it's probably not gonna be so significant that we wouldn't treat her outpatient anyway. And so I didn't order the scan. And a more experienced physician came by and rounded on her, and he said, Aaron, I think we actually need to order the PE study. I was like, yeah, I was kind of thinking about it, and I kind of decided not to. And he's like, yeah, let's just do it. Sure enough, she's got multiple PEs, needs to be admitted for it. And usually you can see that in the vital signs. Usually they're tachycardic, hypoxic. There's some other secondary sign that this is a bad PE, not just a PE we can send home. And so that was a situation where I learned a hard lesson of like, if you're thinking about ordering the scan, just order the scan. Because ultimately that patient's waiting longer for a CT. Had I just ordered it, we would have found the diagnosis sooner. And honestly, PE is one of those diagnoses where I can think of a couple stories like that where I wasn't really on my radar and they ended up having PEs. So that's kind of a sneaky diagnosis, I think, sometimes where, because we can send a lot of these patients home. They're not that sick. They need to be hospitalized with a PE. They just need to be on blood thinners. But some of these people have bad enough clot burden in their lungs, we got to admit them to the hospital. And so that's just one example of the many times that I've failed in emergency medicine. But does anybody else have a specific story?
Never
failed, not once.
I do, actually. So I was a pretty new paramedic, and we had a guy, older gentleman, we'll call him Bob, that lived a couple doors down from our office and in the town that I was working in. And he was pretty known to us because, he lived in the neighborhood. So anyway, he was older and he had a cardiac arrest, and we actually transported him and so on. And I gave him the wrong medicine. And it didn't hurt him, but it didn't help him either. So that was quite an eye-opener for me, and never done that again. However, I feel that we kind of wax and wane in our diligence sometimes, and we get complacent and comfortable, sometimes too comfortable. To that end, I was notified not too long ago, last month, that we'd gone on a call. We'll call her Mary. She's, 50s, 60s, has a history of high anxiety, and she gets ramped up really easily. And she was having a little bit of chest discomfort. She said this wasn't unusual when she has these periods of anxiety. And the people that were there before us with a bigger truck had done an EKG, and they had looked at it, cursed, just kind of not very well. And they said, yeah, this patient is sinus and no problems. Handed it to me. I didn't look at it. And so my EMT partner, actually, she's very good with those kind of patients. I'm not. And so she rode in with the patient and got to the hospital. They put her in triage, and she was there for about 15, 20 minutes. They did an EKG on her, and she had a pretty good lateral MI.
Yeah.
Or anterior lateral, actually. And so we looked at the, I was notified of this, that it had been, complained about. So our clinical education folks asked me to come look at this thing. And so I did. And I went, gosh, that's an MI. And they went, yeah, it was a patient you had. I went, oh, damn. They went to triage. I went, oh, damn.
Oopsie whoopsies, I've made a fucking luckety.
So, those things happen. And it happens at every level. Usually we catch those things, though, because we're a team, right? Mm-hmm. So one person on the team will go, yeah, you missed that. Did you see this MI right here?
Yeah.
And I didn't look at it. The lady was kind of all over the place. There was lots of things going on the scene, and I don't blame the other crew at all, and I take ownership of it. It's on me, because I ultimately transported the patient. But I think, those things keep you humble and, or should, anyway. But yeah, so I had that one, but you get them once in a while.
If I could touch on it, because like anxiety is such an open term, and anxiety is a symptom, is an emotional symptom, or because when my heart rate spikes and I'm at 190, I'm like, I don't feel too good. I need Edison medicine right now. Like me and my old partner now, we had someone, it came in as anxiety, and then I was training, so I'm sitting there typing. And then Trevor looked at me. He's like, hey, Nate, I think we need to do an EKG. I was like, I'm not even here. That's your partner right now. And then literally he puts it on and he's like, Nate. And I look over. I'm like, oh, shit. Oops. And you just see, and I'm like, that's a problem. So no, 100%,
Yeah. Boy, anybody that's had anxiety this last month, I'm like, we'll check this out.
Yeah, it's like, just for my sanity.
Yeah, it's true that if, for example, the PE study, getting a CAT scan on people, now I'm going to be ordering those tests a lot more frequently ever since that case. And that's not necessarily because it's good medicine. It's because I'm paranoid about missing that diagnosis now.
Well, I think you were diligent because you didn't want to do like a CTA because you didn't want to put that load on the kidneys and stuff. Yes, sir.
Since I'm a lonely EMT, your guys are throwing around a lot of big words.
Contrast.
Okay, thank you.
Contrasted CT.
It's just rough on people's kidneys if they have a little bit of underlying kidney disease.
Like
it's
renal shit.
Yeah, just because their kidneys have to filter out the contrast. So we try to protect their kidneys, and so it's you can give them fluids. There's all kinds of reasons, and of course with a PE diagnosis, affecting their kidneys negatively, it's worth making that diagnosis to, have to give them some fluids to rehydrate their kidneys. But
is there any kind of contrast that's easier on the kidneys? No,
not really.
And those patients that you have they're older, they've got arthritis. They take ibuprofen, they take naproxen. It's a big load on your kidneys, and sometimes their GFR is pretty low. Glomerular.
Okay. I was like, you're throwing acronyms out, bro.
So yeah, well, we can talk later. But anyway, if your GFR is too low, your kidneys aren't working. That's one of the markers for kidney failure.
I know the nephron, and that's pretty much it.
Okay, well, the glomerulus.
All right, I know that one.
Okay, that's what. Here you go. So, you can have an anatomy class if you want to.
All right, guys, I'm going to jump in here. I want to thank everybody on the live stream. If you guys got any value out of this today, and don't worry, guys, we're going to keep talking, but if you got any value out of this today, if it resonated with you, if it encouraged you, the only thing I ask is you subscribe to the show on whatever podcast platform you're listening to. Give a 5-star review. That will help a ton. I don't make any money from this podcast and actually pay a fair amount of money to do it. So if you can support the show, that'll be very helpful. If you go to practicalems.com, you can join the email list so you know when all the episodes are coming out. There's an EKG course on there as well if you want to financially support the show. And we'll jump back into the conversation with these folks next time. Thanks, guys.